November is National Alzheimer's Awareness Month, and it comes as many people are adjusting their holiday gatherings this year due to the pandemic. And that can cause confusion for people suffering from cognitive impairment. We're getting some advice this morning on talking to your loved ones. Joining us this morning, Dr. David Gill, director of the Memory Center at Unity Hospital. Good morning, doctor. How are you?
Good morning. Thank you for having me.
Yeah, glad to have you with us. First, I want to ask you, working with patients who suffer from dementia and cognitive impairment, how has the pandemic these past 8 months affected them?
You know, I think we've all realized that no matter what's going on, the pandemic has made that worse. And we certainly see that in the patients that we follow with dementia and other types of cognitive impairment. They struggle anyways, and their families struggle to care for them. But the stresses of the pandemic certainly have made that worse.
Yeah.
All of us benefit from social interaction, and certainly people with cognitive impairment and dementia do. So the lack of social interaction and the social isolation has been really devastating. And even more so, the lack of resources in our area for one-to-one in-person care has been really devastating and very difficult for patients and their families.
Yeah. What is the concern? Because you speak of, and we know how important these holidays are to family members, especially going through this. This is a time that they can cherish and be together. What is your concern that if they can't be together during this time, what happens to those patients?
There's a couple of concerns. The obvious one is it safe to get together? Certainly most patients with dementia are in an age group that puts them in an extra vulnerable spot when it comes to COVID-19. So the first question is, is the bubble small enough and safe enough that we can get together and feel like we're not going to infect our family members? That's the first question. And if we realize we can't, a smaller group might be okay, but we want to be with our loved ones. And so doing things like phone calls or even like this, a Zoom or a Skype, can be quite beneficial because seeing someone's face can really help quite a bit.
Right. How do you suggest loved ones talk to their loved ones who are dealing with Alzheimer's right now, to explain why they can't get together? How do they work through this?
It depends a little bit on the severity of cognitive impairment. For people with more marked impairment, meaning they're quite forgetful, it's best to try to acknowledge the concern and move on. So if someone says, "Why can't we be together?" it's fair to say, "Well, it's upsetting we can't. Hopefully next year we can," as opposed to going into a long, in-depth discussion trying to reason through it. The person may have a hard time figuring it out and then ask the question again later. For people with more mild memory problems, it's fair to go through it in detail because eventually people will learn the explanation.
Right.
But for many of the patients that we see, it's pretty confusing to try to figure out why they need to wear a mask, why they can't be together.
Yeah.
And we want to avoid those confusing conversations over and over.
All right. What about some ways to include everyone? So say the family can't all be together. How do you make sure that everyone's included and not forgotten?
Well, certainly, like I mentioned, a phone call, or my light went out of my room. My phone call or a video chat will be quite helpful. But one thing about communicating with somebody with dementia in particular, it's best to either focus in this exact moment, discuss what we're eating at the Thanksgiving table, or discuss something that happened in the past. And so if we can't be together, it's fair to talk about those memories from a childhood or when we were together before. And those memories are often intact from years ago.
Yeah.
So even if we can't be together, talking about when we were together can be quite helpful.
Yeah, this is certainly a time that we will not forget. It's such a difficult time, but hopefully we can get through this together. Thank you, Dr. Gill, for your time this morning.
Thank you so much.